Okay, I am washing my hands for 15 seconds. While I'm doing this, I just want you to get a visual cameraman of my workstation and do a 360 view because I really don't want any accusations. Came too far in my career, so just film everything. So I get my workstation really well, so I don't have any accusations before I go in and meet my patient. Hello.
Hello.
My name is Justine. I'm going to be a nurse practitioner today. How are you?
I'm good, thank you.
What is your name?
Ronacina,
What is your date of birth?
52483.
Okay, and do you know why you're here?
I'm here for head to toe assessment.
Okay, beautiful. And do you know what this place is?
This is my kitchen.
Awesome. Do you know what you ate for breakfast?
We had eggs and toast.
Okay, I'm going to give you 3 words. I want you to remember those words, and then I want you to repeat them in a little bit, okay? So, apple, penny, car.
Apple penny.
Okay, so
Got it.
I'm going to take your vital signs now. The first thing I'm going to do is take your blood pressure. (120/76). Very good. Okay, so the next thing I'll be doing is I'll be taking, palpating your radial pulse for 15 seconds. Okay, great. Pulse was 62, respirations were 12. Okay, the next thing I'm going to be doing is I am going to be assessing your head. I see it's normocephalic, age traumatic, and I'm going to be assessing your scalp. So if you could just undo your hair real quick. Thank you, and put your head forward. Okay, so I see that her hair is equally distributed. Is this your real hair?
Yes.
Okay, it's equally distributed. It's fine in texture, it's long, it's beautiful, it's very curly. I'm going to be assessing the scalp now. I don't see any scaling, no alopecia, no dryness, a lot of hair here. No infestation. I'm just going to get the back real quick. And your scalp looks good. Okay. So next thing I'm going to be doing is palpating. So you could just, keep your head normal. And tell me if you have any tenderness.
No.
Okay. I'm feeling for any masses. I don't feel any masses. No indentation felt. Okay. You can put your hair up. Thank you very much. The next thing I'm going to be doing is I'm going to be looking at your face. It's symmetrical. I don't see any edema. I don't see any hair on the face. I don't see, there's a few freckles right by the cheeks, and there is a birthmark on the right cheek. The next thing I'm going to be doing, I'm looking at your eyelashes. They're equally symmetrical, and your hair is equally distributed in your eyebrows. The next thing I'm doing is I'm looking at your eyelids. There's no edema, no ptosis, no lesions. Your lacrimal apparatus is not tearing, and your eyelashes are long and they curl. Beautiful eyelashes. Next thing I want to do for infections reasons, just pull up for me, like this, so I can look. Peribulbar and bulbar, look up, please. Peribulbar and bulbar is pink, and then just push down on the eyelids like this, and the sclera is white. Wonderful. Okay, so the first thing I'm going to do is I'm going to just put a cotton swab on your face. Close your eyes and tell me, just say yes when you feel.
Yes. 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 Yes.
Okay, beautiful. Next thing I'm going to be doing is I'm going to be asking you to keep your eyes closed again, and then I'm going to go, tell me if you feel sharp or dull, okay?
Mm-hmm. Soft. Dull.
Good,
Sharp. Dull.
good,
Sharp. Dull. Sharp. Dull. Sharp.
good. Okay, now open your eyes and then clench your teeth and move side to side. Okay, wonderful. So trigeminal nerve number 5 is intact. The next thing I'm going to be doing is I want you to make a smile, puff out your cheeks, look surprised, and give me a frown. Cranial nerve number 7, the facial nerve, is intact. The next thing I'm going to be doing is assessing your visual acuity from arm's distance. So with one, please occlude one right eye, and I want you to read the finest print where my finger is.
LTFPH.
Okay, and now occlude the other eye.
LTFPH.
Okay, so both eyes, please read.
LTFPH.
Okay, beautiful. Visual acuity is 20/20 with non-corrective lenses. Okay, now the next thing I'm going to be doing is I'm going to test your cranial nerve 3, 4, and 6, oculomotor, trochleomotor, and abducens. So just do me a favor and follow my fingers and keep your head still, okay? Good, wonderful. And just for accommodation. Good. Convergence is present, accommodation is present, and I'm going to come behind you and you tell me, occlude the right eye, I occlude the left eye, and you tell me when you feel, when you see my fingers wiggling, okay? So get behind you, okay.
No.
Okay,
No.
good,
No.
good. Now occlude the other eye, I'm occluding my other eye. My left eye, I'm including,
No.
good,
No.
good.
No.
Okay, so convergence and accommodation is intact. Oculomotor, trochleomotor, and abducens 3, 4, and 6 is intact. All right, so the next thing that I'm going to be doing is I'm going to be looking at your eyes with my pen light. And I see that the eye, there's no presentary shadows. The cornea is clear. The sclera is white. The pupils are 4 millimeters round, equal in size. And I don't see any presentary, the iris is flat and round. Okay, very good, sorry, your eyes okay? So what I do on this side, I do on that side, okay? So I'm just gonna dim the lights. And we're gonna check for your pupils to see if they restrict. So you just stare at my nose while I do this, okay? And pupils constricted with direct. Do it one more time. And pupils constricted with direct. So pupils are equal, reactive to light, and accommodating. So the next thing I'm going to do is I am going to look at your nose. I see that your nose is symmetrical. There is no trauma to the nose. Going to ask you to identify the smell. You can open your eyes or close, whatever you prefer.
Alcohol.
Beautiful. So olfactory nerve, cranial nerve number 1 is intact. The next thing I'm going to do is look in your nose. Okay, so I'm going to insert the nasal speculum. So put your head back, and I'm going to take a look in there. Okay, so nasal mucosa is pink. I don't see any discharge. I don't see any polyps. I do see a little bit of fine hair. No perforation, no scarring, and septum is midline, no deviation noted. Very good. So the next thing, I just wanted to give your eyes a little break. Now I'm gonna dim the lights again, and I'm gonna check your eye. I'm putting the diopter down to 0. And I'm gonna look in the eye. Whatever I do on this side, I'm doing on that side. So the red light reflex is visualized optic cup is visualized. It's yellow in pigmentation. I don't see any AV nicking. I don't see any bulging. I don't see any opacities. And the macula is slightly pigmented, and the optic disc ratio is less than 0.5. It's beautiful. I'm sorry, your eyes okay?
Yes.
I know that's a bit much. So the next thing that I'm going to do is I am going to test your hearing. So please occlude your right ear, and I'm going to whisper something behind you, and you just tell me what it is.
1, 2, 3.
Good. Occlude the next, the left ear.
4, 5, 6.
Okay, so cranial nerve number 8, acoustic, is intact. Do me a favor, push your shoulders up, pushing down, okay? And the next thing I want you to do is resist my hands. Good, resist my hands. Okay, so cranial nerve number 11, spinal accessory, is intact. So now I am looking at your mouth. It's symmetrical, your lips are pink. They are not dry, and then I'm going to give a look inside your mouth, okay? So I need you to open. I'm going to get in, no, just open. I'm going to get in the buccal mucosa. Mucosa is pink. I don't see any ulcers around the mouth. Good dentition. Just lift up your tongue for me. No cyanosis. Stick out your tongue. The tongue is pink. No inflammation noted. It's moist. And then I want you just to go, ah. Okay, so the uvula rise midline, and elevation of the hard and soft palate as well. And one more thing, I'm just gonna test the gag. So I'm gonna test the gag reflex, okay? And okay, sorry about that. Okay, so there was no lesions, there was no ulcers around the mouth. Cranial, the uvula rise midline, the elevation of the hard and soft palate, I saw, it's symmetrical, it was pink, and also there was a positive gag reflex. So cranial nerve number 10, the vagus nerve, and cranial nerve number 9, glossopharyngeal, intact. Okay, so the next thing that I'm going to do is I will be, throw this out. I'm going to palpate. So you tell me, I'm going to palpate your nose. Any tenderness?
No.
Okay, beautiful. I'm going to palpate here, the frontal. Any tenderness?
No.
Okay. Any tenderness here?
No.
Any tenderness here?
No.
Okay, good. The next thing I'm going to do is palpate your lymph nodes. Okay, so just look straight ahead. Okay, so pre-auricular, post-auricular, occipital. Just look straight ahead of me, like this, good. Submental, submandibular, tonsillar, anterior cervical, superficial cervical, anterior cervical, posterior cervical, and just move up for the subclavicular. And no lymph nodes are felt, no enlargement, very good. The next thing I'm going to do is I see the TMJ, I don't see any inflammation, I don't see any redness. I'm going to palpate your TMJ. Okay, so open your mouth up and down, side to side, no clicking, no popping, so TMJ is intact. The next thing I'm going to do is assess your ear. So what I do on this side, I do on that side. So from the right ear, there's no inflammation, there's no redness. Does this hurt?
No.
Does this hurt?
No.
Does this hurt?
No.
Okay. This hurt?
No. No.
Okay. Manipulation of the tragus? Does it hurt?
No.
Okay. So I'm looking behind, palpating also, and there's no inflammation right behind the ear, so that's really good. So now I'm going to go in with the speculum. I'm going to pull your ear up and back, and I'm going to go in. So I don't see any redness. I don't see any inflammation. I don't even see earwax. Your beautiful ears. I do see the tympanic membrane. Wow, it really is pearly gray. Awesome. And I'm getting excited over this. No perforation, no scarring, and no discharge. And the Kona light, I see it. It's visualized at 5 o'clock. Very good. So before I forget, so the sensory and motor was intact, but I also want you to so I can just tell me dull, sharp, okay? Just to see if sensory and motor was intact through your upper and lower extremities, okay?
Sharp. Dull. Sharp. Dull.
Good.
Sharp. Dull.
Hands, hands, hands.
Sharp. Dull. Sharp.
Good.
Dull. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. 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 Sharp. Dull. Sharp.
Beautiful. So sensory motor is intact. I just didn't want to forget that step. Okay, so the next thing that I will be doing is I'm checking your skin. Okay, warm to touch. The skin is consistent with ethnicity. I don't see any lesions. I don't see any moles. I do see freckles on the upper and lower extremities. I'm going to be looking at your hands now. Your web spaces are intact. I don't see, with the nails now, the nail beds are pink. I don't see any clubbing. I don't see any cyanosis. I don't see any cigarette staining. I don't see any splinter hemorrhages. I'm just going to check your capillary refill. Less than 3 seconds. Elastic recoil, less than 3 seconds. So skin turgor is good. Okay. And I am now looking at, there's something else that I had to do, but I'm trying to remember. Okay, so I am looking at, is it that nerve? Is it the, oh, stick your tongue out. Like protruding, like stick it out and move side to side. Okay, so that was cranial nerve, the hypoglossal, and that was cranial nerve number 12 intact. Okay, very good. So now what we're going to do is we are going to, I'm going to ask you, what were those 3 words that I said before?
Penny, apple, card.
Okay, so my patient is A&O times 4. Speech is clear, it's coherent, she's well kept, she's well nourished, and she's not in any acute distress. So now I'm going to have you turn around all the way, and we're going to assess the posterior chest. Okay, so flex, look down. So the cervical spine is visualized. I'm going to palpate. Any tenderness?
No.
Okay, so you can just, so in the spine, I don't see, it's linear. I don't see any kyphosis. I don't see any lesions. I don't see any moles. I do see freckles on the upper back. But everything looks good. The AP diameter is about 1 to 2 inches. So the first thing that I'm going to be doing is I'm going to say a word, 99, and I just want you to repeat that, okay? Okay, just hold your hair up while I do that, please. Okay, I'm going to palpate for tenderness first, sorry. Any tenderness?
No.
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 Okay.
No.
Just tell me if you have any tenderness,
No.
okay? Okay, so palpation, I didn't feel any masses, and there was no tenderness. Okay, next thing I'm going to do is you say the word, every time I move my hands, you say the word 99.
99, 99, 99, 99.
Okay, tactile fremitus is present. The next thing I'm going to do, I want you to whisper really low the word 99, okay?
Okay.
Elbows crossed, please. Okay, so whispers were heard distinctively. The next thing that I want you to do is say the word E. E, 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 E. Okay, so I heard E. I didn't hear, I heard a muffled E. I did not hear an A or an A. So that was good. The next thing I'm going to do is I am going to percuss. And I'm hearing resonant. Just elbows crossed, please. Okay, so on percussion revealed resonant. Okay, the next thing I'm going to do is I'm going to auscultate. Actually, I'm doing diaphragmatic excursion. I'm sorry, I apologize. So I want you to take a deep breath in and a deep breath out, and I want you to hold it on exhalations. Do you understand the instructions that I just gave you?
Yes.
Okay, very good. So tell me when you're ready.
Get ready.
Okay. You ready? Take a deep breath in, deep breath out, and hold it on exhalation. Okay. Exhale, exhale, breathe it out, breathe it out. Okay. So take a deep breath in, deep breath out, and hold it on inhalation. I'm going to measure, exhale it out. And it is about 5 centimeters, and it's at level at the T7. So very good diaphragmatic excursion. It was 5 centimeters at T7. Now I am going to do expansion. So I want you to take a deep breath in and a deep breath out. Let's do that over. Deep breath in, deep breath out. Okay, so expansion was in normal limits. So I'm going to also take now. Take a deep breath in, exhale. 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 Push your arms deeper. Deep breath in, exhale. Deep breath in, exhale. Deep breath in, exhale. Deep breath in, exhale. Great. So bronchial, bronchial-vesicular, and vesicular breath sounds were heard. No adventitious lung sounds. Lungs were clear. You okay?
Yeah.
And I want you to turn around now so I can do the anterior part of your chest. So the first thing before we do that, I just want to do the Weber test and the Rhine test. So I'm going to strike this, and you tell me if air can, you tell me if you hear the sound on both sides or on one side, okay?
Yes. Both sides.
Very good. Now I'm going to do the Rhine test, and I'm going to apply it behind your mastoid. Look that way, please. Tell me when you hear it
I hear
and
it.
when it starts to fade.
It's starting to fade.
Tell me when you hear it
I hear it.
and when it starts to fade.
And it's fading.
Okay, beautiful. So Weber and Rhine test, we're good. So now I'm going to assess the chest. I don't see it symmetrical. I don't see any subclavicular retractions. I don't see any accessory muscle use. I don't see any lesions, moles. Again, there are some freckles on the anterior portion of the chest. And I don't see any cyanosis, okay? So the next thing that I'm gonna be doing is palpating for just any masses or tenderness. Can you tell me if you have any tenderness?
None.
Okay, where's your sheet, please? And just keep that up until I get under, then you drop it, okay? Any tenderness there?
None.
Any tenderness there?
No.
Okay. Any tenderness?
No.
Okay. Okay.
No.
So now I'm going to percuss. Oh, I'm going to do diaphragmatic excursion. So take a deep breath in and exhale it out. A deep breath in and exhale it out. So expansion, diaphragmatic expansion within normal limits. Next thing I'll do is percuss. And I'm hearing resonant. I'm going to get under here, sorry. Okay. Just hold this up like this so I can keep percussing. No, hold it. Actually, pull it up, because they need to hear the sound. So I'm just going to keep percussing. Okay. You can lower it. Lower it. Lower the sheet. Lower the sheet. I got to finish percussing. Resonant. Resonant. So resonant was heard on percussion, and now I'm going to auscultate. Take a deep breath in. Exhale. 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 Deep breath in. Exhale. Deep breath in, 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 exhale. Bronchial, bronchiovascular, and vascular sounds were heard. No adventitious lung sounds. Lungs are clear. They sound great. So the next thing I want to do is just palpate here your temporal arteries. And they're burst non-bounding. Okay, and now I am going to actually palpate your carotid. I'm going to palpate it, so look at me, look at me. Burst non-bounding +2. Burst non-bounding +2. I'm going to ask you to take a deep breath in. We're at a 45-degree angle, by the way. I'm going to ask you to take a deep breath in and hold it, okay? So, you ready? And just take the deep breath in and hold it until I tell you to stop holding it. Keep it. Okay, exhale it out. No buoys heard. Okay, so now I am going to palpate the landmarks of your heart. So, second intercostal space. Just relax, please. Second intercostal space is the aortic. Right sternal border. Second intercostal space is pulmonic. Left sternal border. Third intercostal space is Erb's point. Fourth intercostal space is tricuspid. And fifth intercostal space, mid-clavicular line is the mitral valve. And now I'm going to auscultate with the diaphragm, and then I'm going to auscultate with the bell. Okay? So I'm auscultating the aorta. Second intercostal space, right side, right sternal border. Pulmonic, second intercostal space, left sternal border. Erb's point. Third intercostal space, left sternal border. Tricuspid. Fourth intercostal space. And I'm going to pull up. Fifth intercostal space, mid-clavicular. And I'm just going to listen to the apex, and I'm going to have you lean forward, please. I don't hear any pulse deficits. No S1, no S2, no splitting. No. I heard S1, I heard S2. I did not hear S3, I did not hear S4, I did not hear splitting, and I did not hear any gallops or murmurs. So now I'm going to just listen real quick with the bell. Aorta. Pulmonic. Erb's point. Tricuspid. Get under. Put the sheet up if you need privacy. Mid-clavicular line, mitral. Again, move forward. Okay, no S1. S1 and S2 heard. You need to lay down at a 30-degree angle now. And just put the sheet over for privacy for you, please. So S1, S2 again. No S3, no S4, no splitting, no gallops, and no murmurs. So I'm going to actually look at your JVP. I want you to look to the left, all the way to the left. And I see the pulsation right there. Beautiful. Okay, so relax. The next thing I'm going to be doing is auscultating the heart again with the diaphragm and the bell. Aorta. Pulmonic. Erb's point. Left sternal border now I'm on. Tricuspid. Just put this up because I don't want on your border. Cover yourself. Tricuspid. And I'm going to go under mid-clavicular line. Fifth intercostal, you can put it down so they can see where I'm at. And I'm listening to the apex again. No pulse deficits. Again, with the diaphragm. With the bell. One more time. Right sternal border, second intercostal space. Aorta. Aortic. Pulmonic, second intercostal space, left sternal border. Erb's point, third intercostal space. Left sternal border. Tricuspid. Just cover yourself again. Just cover with the sheet, tricuspid, fourth intercostal space. And keep covering yourself, keep covering yourself. I'm gonna lift up your bra. Keep covering yourself so I get under. Mid-clavicular line, fifth intercostal space. Okay, good. No, I heard S1, I heard S2. Turn to your left. No S3, no S4, no splitting, no gallops. Heard. Everything is superb. So, I'm coming on this side, and I'm just gonna, I'll palpate again. I'm gonna put the thing up. I'm gonna palpate for any, put the sheet up. I'm gonna palpate the mitral for any heaves or thrills, and then you can see what I'm doing. You could, wait, no, don't put that sheet down. Can you just, I gotta get under here, so I can actually palpate the aorta. I mean the mitral, sorry, the apex of the heart. Okay, put down. So I'm palpating. I don't hear any heaves. I don't feel any heaves. I don't feel any thrills. It's about a quarter in diameter. Please lay flat. I'm just going to press here for any arms and my fingers for no heaves, no thrills. And no heaves or no thrills. Beautiful. Okay, so the next thing I am going to do is I'm going to have you, I'm going to assess the belly. So I'm looking at the belly. It's flat. I don't see any dilated veins. I don't see any protrusions. I don't see any pulsations. The umbilicus is midline. I don't see any scarring. So I'm going to take a listen to your bowel sounds now, okay? So right upper quadrant. Left upper quadrant. Right lower quadrant. And left lower quadrant. Very good. Bowel sounds are normal and reactive. Now I'm going to listen for any bruits at the aorta, which is right here, with the bowel. No bruits. I'm going to listen to the renal above the umbilicus. The iliac arteries below the umbilicus. Okay, and now I'm going to get in the femoral. Lift up the sheet, so I'm just going to pull right here. So, okay, you could, no, don't, yeah, I don't want you exposed. You could put down a little bit, suck it in. You want femoral, no buoys, inguinal nodes. Okay, so the femoral I'm going to palpate, okay? So I'm going to get in there. Breast non-bounding. Breast non-bounding, very good. The next thing I'm going to do is percuss your abdomen, okay? So I'm going to get on this side. I'm right-handed. Let's do over. I'm going to come on one side and do it. Okay, good. Tympanic. That's what I want to hear. I got to come on this side and do it. Tympani and dullness here because the left lower quadrant is dull. So now I am going to, I'm right here, so I might as well percuss the spleen, and then I'll do your liver span. So you're on this side, you're getting me? So I'm going to percuss the spleen. Tympani, negative on the spleen. Now I'm going to measure the liver span, okay? So I'm going to go from tympani to dullness, from the umbilicus up. And now I got to raise because I got to get by T4. Yeah, keep the sheet up, just so I can get by the nipple line. And and then you can let it go. Let it go. Resonant to dullness. And I'm gonna measure. And it is exactly 6 centimeters, exactly. So your liver span is normal, 6 to 12 is normal. So the next thing that I am going to do is put your back real flat. I need you flat. And I'm gonna have you take a deep breath in, and I'm gonna palpate the liver, okay?
Okay.
So pushing in, exhale. Pushing in, exhale. Okay, do it again. I'm doing it with my right hand, sorry. Push in, exhale, push in. Inhale, exhale. You guys get it. So the liver, the borders were felt, no nodules were felt there. So the spleen, now with my left hand, I'm gonna have you inhale and exhale. Inhale, exhale. Inhale, exhale. One more time. Inhale, exhale. Spleen non-palpable. Okay, the next thing I'm going to do is look at your vasculature. Push your legs down. Okay, warm to dry. I don't see any discoloration. There's some freckles here noted on the knees. There's no cyanosis. There's no involuntary movements, and there's no pitting edema. There's no edema anywhere, but we'll just verbalize that. So the first thing that I'm going to be doing, I'm going to be taking all your pulses. So your brachial, brisk non-bounding, radial, brisk non-bounding, posterior tibial behind the malleus, brisk non-bounding, posterior tibial behind the malleus, brisk non-bounding. Now your dorsal pedis, brisk non-bounding, dorsal pedis again. Brisk non-bounding. Put one leg up for me, please. And I'm going to get behind here. Got it. Brisk non-bounding, 2+. They're all 2+ without, throughout. Hard to get. Got it. Brisk non-bounding, 2+, and I'm coming back. I didn't forget about here. Brachial pulse palpating. Brisk non-bounding, radial, brisk non-bounding. I'm going to auscultate real quick all of my pulses. Brachial, radial, brachial, radial, feet down, dorsal pedis, posterior tibial malleus, dorsal pedis, posterior tibial malleus. Okay, listen, move up a little bit because we're going to do some maneuvers. I don't want you to be uncomfortable. So, first thing that I want you to do is I want you to flex your knees, put your knees all the way up. There you go. Push them down. Pull them down. Good. Watch my fingers. Dorsiflex. Plantar flex. Dorsiflex. Good. Abduct. You can lift your legs up and do it though. Abduct. Adduct. Abduct. Adduct. Good. Good job. Now the next thing I want you to do is I want you to raise one leg up. One leg up. Resist me. Resist me. Resist me here. Don't let, keep like, don't let me push them up. Good. Don't let me push. Good. Okay. So put your knees up again, and you can just keep them right here. Okay. Don't let me push. Don't let me put. Keep them straight. Don't let me push. Resist me. Resist me. Resist me. Resist me. Muscle strength. Good. 5 out of 5. All pulses with 2+ brisk. And full range of motion. Next thing I want you to do is come. Wait. Sorry. I'm gonna palpate the hips. Any tenderness?
No.
Any tenderness here by the knees?
No.
Any tenderness by the ankles?
No.
Any tenderness on the toes?
No.
Any tenderness on these toes?
No.
No crepitus, no tenderness. Come around. I'm going to palpate here. Any tenderness?
No.
Any tenderness on the elbows?
No.
Tenderness on the wrists?
No.
Tenderness on any of the fingers?
No.
No crepitus, no tenderness,
No.
no inflammation I felt around all of the joints. That's it. Okay, the next thing I'm gonna do is, I'm coming behind here because I forgot to check the CBA, so get the cameraman over here.
5 minutes.
I'm gonna give you a jab and you tell me if you feel it, okay? Any pain?
No.
Any pain?
No.
Okay, CBA, good. Okay, so now come down and just follow me. Extend, flex, supinate, pronate. Good. Now take your fingers and extend, flex, put them together, adduct, pull them apart, abduct. Opposition, opposition, good. Okay, make a circle, don't let me pull out. Good. Grip strength, good. Strong, strong grip, good. Now I'm gonna give you my index finger, don't let me pull it, don't let me pull it. Okay, one arm up, resist me, resist me, resist my palms, resist this. Cross, resist, resist, resist me, and resist me. Full range of motion, 5 out of 5. The next thing we're gonna do is, ready? We're gonna do extend, we're gonna do flex, we're going to do to the right shoulder, we're going to do to the left shoulder. Very good. We're going to look down, we're going to look up. We're going to lateral bend, side, to the left side, excuse me, to the right side. Good. We're gonna rotate, we're gonna rotate. Very good. So no problems with the lumbar spine. Now I want you to ambulate and walk from foot to foot like this, one in front of the other. Good. Heels, walk on your heels now. You can turn, walk on your tippy toes. No, don't jump, just walk on your tippy toes, ma'am. Okay, very good. Walk steady, steady gait, just walk steady. Okay, gait is steady, no problems with ambulation, and posture is erect. The next thing that we're gonna do is we're gonna do, just close your eyes and put out your hand, close your eyes for 15 seconds. Feet are together, arms are together. Open your eyes, 15 seconds. Negative Romberg, very good. Now I want you to do this, but close your eyes and do it. Negative pronated drift, very good. Okay, now open your hands, close your eyes. What is this object in here?
A coin.
What is this object in here?
A pencil eraser.
Good, have a seat, I'm doing your brachial reflexes. Okay, first any vibration, you let me know when it starts and when it stops on your hands.
Okay. Starting. Stop. Starting. Stop.
Toes,
Starting. Stop. Starting. Stop.
okay, we're doing the reflexes real quick. I'm doing the radial. Good, tricep. Good, did it go? Tricep? Good. Okay. Brachial radial. Good. Brachial. Good. Good. Tricep. Get the arm a little relaxed. Good. Brachial radial. Good. Quadriceps. Good. Quadriceps. Good. Achilles. Good. Achilles. Good. And Babinski. Babinski. Ready? And the toes are curled. They didn't fan. How much time we have left?
1 minute.
1 minute. I think we, thyroid gland. Here, take a sip of water. I'm coming behind you. Take a sip of water. Okay, no enlargement of the thyroid gland. No nodules felt, smooth, and I felt it go down as she swallowed. I think that's a wrap. I think I got all of them.
30 seconds.
Did I forget anything? I hope I didn't forget anything. I hope I didn't forget anything. I palpated the lymph nodes. I did everything. The cranial nerves, they're all done. Right?